Welcome back to the Deep Dive. It is Thursday, February 12th, 2026. And, when I look at the calendar and see 2026, I expect us to be talking about, I don't know, AI breakthroughs, maybe the latest Mars mission.
Something futuristic, right?
Exactly. But today feels like we've stepped into a time machine and we've gone backward.
It really, really does. I mean, if you are anywhere near Mexico City right now, the vibe on the street is, well, it's tense. We're looking at a measles outbreak.
And not a small one.
No, not at all. We are talking about over 8,000 cases nationally.
That number is just staggering. Measles. I mean, that feels like something from a history book. I thought we'd sort of close that chapter.
You would think so. But biology has a way of humbling us. The epicenter is active right in the capital, in CDMX, and it's not just a medical statistic anymore. It's becoming a logistical nightmare.
I bet.
You walk down Reforma, you see the hygiene protocols kicking back in. It's very reminiscent of the early 2020s, but the context is different this time.
And that context is exactly what we're here to unpack.
Right.
We are not going to spend our time analyzing rashes or, incubation periods. We're digging into a very specific, very stressful friction point that thousands of people are waking up to this morning.
The workplace.
The workplace. Because the economy doesn't just stop.
Mm-hmm.
People still have shifts, deadlines, bosses.
Right. So here's the conflict we're looking at today. You have this health crisis, you have active hygiene protocols, but you also have the daily grind. So the big question, based on this legal analysis we found called Sarampión, Trabajo y Prevención Laboral, is can you actually leave work to get vaccinated?
And can your employer just say no?
And if they do, how much trouble are they really in?
And spoiler alert on that one.
Oh, yeah. If they say no and they get caught, the price tag is enough to bankrupt a small business.
We are absolutely going to get to those numbers, and trust me, they are eye-watering. But let's start with the basics. I think a lot of people just assume, oh, it's a health emergency, the rules must be clear.
But they're not.
Looking at our source material, it's not that simple, is it?
It never is with the law. This whole situation is highlighting this massive gap between what people think the law says and what it actually says. We're going to look at the federal labor law, the public service law, and all those financial risks.
Okay, so set the stage for us. 8,000 cases. Why does this matter right now, today, for my job?
Because it's no longer theoretical. In Mexico City, immediate safety and hygiene protocols are active. This isn't a maybe we should be careful situation.
This is real.
This is active containment, and that means the workplace is the new front line. If you have an office, a factory, a shop, that's where the virus can spread. So the decision to let someone go get a shot, it isn't just a personal favor, it's a public safety decision.
Okay, so let's role play this. I'm an employee, I see the news, I'm worried, I want to go get my booster. I walk into my boss's office and I ask for a few hours off to go to the clinic. Does the law actually say word for word, I have a right to leave work right now to get this vaccine?
The short answer? No.
Wait, really?
Really, and this is the first big aha moment from our analysis. If you open up the federal labor law, the LFT, and look for an article called vaccination permit,
It's not there.
it doesn't exist. You can't flip to page 50 and point to a clause that says measles vaccination time.
That seems like a massive oversight. I mean, after everything we all went through a few years ago, you'd think there would be a dedicated clause for this by 2026.
It does seem that way, doesn't it? But, legal systems often work on broad principles, not specific shopping lists of events. If you list every single disease, you'll just miss the next one.
That's a good point.
So while the specific words aren't there, the right does exist. It's what lawyers call a derived right.
A derived right. Okay, explain that. What does that mean?
Think of it like a legal Lego set. The specific vaccine brick isn't in the box. But you have other bricks obligations for safety, hygiene, health. We have to construct a right to vaccination by snapping those other bricks together.
I like that analogy. So we're building a legal argument out of the pieces we have.
Okay, so if the rule isn't explicit, how do we play it? Let's start with the private sector, using the LFT. How do we build this case?
We start with the employer's obligations. So we look at Article 132, Fraction 17. This article says, employers must comply with safety and hygiene provisions to prevent illnesses.
Okay, so preventing illness. That's the key phrase.
Exactly. The legal logic in our source is that allowing vaccination is, by definition, it's the ultimate preventive measure.
Yeah.
If an employer blocks it, they are failing to prevent illness. And the text specifically mentions avoiding a massive incapacity.
Massive incapacity. That sounds absolutely terrifying for a business owner.
It should be. Imagine a small firm with, say, 20 people. Measles is so contagious way more than the flu, more than COVID. If one person brings it in because they couldn't get vaccinated, you don't just lose one worker for a day. You could lose the whole team for weeks.
So letting them get the shot is actually protecting the business.
It's protecting their own continuity.
Yes.
Okay, that makes sense. Enlightened self-interest. But is there anything more specific to this particular outbreak?
Yes, and this is the stronger lever. This is the brick that really solidifies our Lego structure. Article 132, Fraction 19Bs. It's the emergency clause.
The emergency clause.
Yeah.
Sounds dramatic.
It is. It says that if the competent authority, so the health ministry, the Secretariat of Salud, issues specific guidelines for emergency, the employer must obey.
So if the health ministry says, go get shots, the employer has to let you.
Correct. It removes the choice. If the guidelines for this 2026 outbreak say vaccination is key, then blocking it becomes a direct violation of the law. It stops being a management decision and starts being a compliance mandate.
Got it. So the boss is pretty boxed in. But what about me, the worker? Let's say I'm hesitant. Can I just say, nah, I'll take my chances?
Well, it's a two-way street. Our source points to Article 134, Fraction 10. That's the worker obligation.
Okay.
It says employees are obligated to undergo medical checks to prove they aren't carrying contagious diseases.
Oh, interesting. So if I refuse to take preventive measures during an active outbreak, I'm actually the one breaking labor law.
In a situation like this, yes, you have a duty to not be a biohazard to your colleagues. It's not just about your health, it's about the safety of the entire workspace.
That really puts a different spin on it. A collective responsibility. Okay, that's the private sector. But what about government workers? I mean, that bureaucracy is a whole different beast.
The spirit is the same, prevention is key, but the mechanics are, well, different. In the public sector, we look at Article 43, Fraction 8. Dependencies must prevent risks. That's the core idea. But getting the actual time off is much more procedural.
Procedural. That's a nice way of saying drowning in paperwork.
Exactly. Article 111 covers licenses. In the government, you usually have to go through the Social Security institutes like IMSS or ISTO. They view epidemiological prevention as a justified cause for an absence, but you have to follow the steps.
So I can't just shout measles and run out the door.
No, you need the license. You need the paper trail. In the private sector, it might be a quick chat with HR. In the public sector, it's a form, a stamp, and a process.
Okay, that makes sense. Private sector is preventive measures logic. Public sector is justified cause and the IMSS rulebook.
Precisely.
All right, let's pivot. We've established the right exists, even if we had to build it out of legal Legos. But let's be real. There are bosses out there who will still say, I don't care, we have a deadline, get back to work.
Oh, for sure.
What happens then? You teased some scary numbers earlier.
I did. And this is where the source material gets really, really serious. We need to talk about the teeth of the law, because a law without a fine is just a suggestion.
Okay, let's see those teeth. How hard do they bite?
If a boss denies that permit, they face administrative fines under Article 994, Fraction 5.
Article 994, what's the damage?
The fines are based on the UMA, the unit of measurement and update. For 2026, the source puts the UMA at exactly $117.31 pesos.
117 pesos.
Mm.
I mean, that sounds like lunch money. Not much of a deterrent.
It isn't until you apply the multiplier. The fine for this ranges from 50 UMAs all the way up to 5,000 UMAs.
Okay, wait. Let me do the math here. 5,000 times 117.
It comes out to a maximum fine of $586,550 MXN.
Whoa. Over 500,000 pesos.
Per infraction detected.
Hold on. Per infraction. So if I have a team of 10 people and I tell all of them, no vaccine for you, I could be looking at 10 fines.
Potentially, yes. It depends on how the inspection is done, but the liability can be cumulative. If an inspector walks in and sees a systemic denial for 10 people, the math gets very ugly, very fast.
That's it. That is bankruptcy level for a small business.
It absolutely is. And that's just the fine. That's just the money you pay the Ministry of Labor. There's a domino effect that's arguably worse because it sticks with you.
Worse than 500,000 pesos.
If you deny the permit and then an outbreak happens in your office, well, congratulations, you've just created a risk of work, a riesgo de trabajo.
Which means the IMSS gets involved.
Right. And if the IMSS classifies those infections as work-related because you blocked prevention, your risk premium payments go up. That's a permanent increase in your operational costs. You're paying a higher tax on every single employee's salary because of that one mistake.
Wow, it really is a domino effect. The huge fine, then higher taxes basically forever.
And there is one more layer, the nuclear option, if you will.
Okay, hit me.
Obstruction of health programs. The source notes that the STPS, the Ministry of Labor, set precedents during the COVID era. If you block vaccination, you aren't just being a bad boss, you are obstructing a public health program.
Which sounds like a crime.
It opens the door to sanctions under the General Health Law, which is a completely separate legal beast from labor law. So now you're fighting a war on two fronts, labor authorities and health authorities.
All because you wouldn't give someone 3 hours off to get a shot.
Exactly. It's a catastrophic miscalculation of risk. You're stepping over dollars to pick up pennies.
This is wild. It seems so obvious when you lay it all out, but I can see how the tension rises. The source material actually has this great chart, a critical perspective table that breaks down this tug of war.
Yes, I was highlighting that section. It really humanizes the conflict. It moves away from the legalese and looks at the anxiety on both sides of the desk.
Okay, let's break it down. On one side, you've got the worker. Their perspective is pretty primal. I don't want to get sick.
Right. They're standing on Constitutional Article 4, the right to health. But their fear isn't just medical, it's financial. The chart points out their biggest fear is reprisals or salary deductions.
If I go, will my paycheck be short this week?
Will my boss hold this against me later?
Yeah, exactly. It's a valid fear. And the requirement for them, according to the source, is proof.
Ah, the receipt.
Yes, that's the trade-off. You must provide proof of vaccination. That little piece of paper or digital certificate, that's the golden ticket. It turns an absence into a paid leave. Without it, the argument kind of falls apart. Okay, then you flip the table to the employer. We've talked about the fines, but their day-to-day fear is just keeping the lights on.
Operational continuity. Their number one fear is the sanitary closure, the clausura sanitaria. If the authorities declare their office an infection hotspot, they literally stick a seal on the door and nobody works.
Which is death for a business.
Total death. But they also fear losing productivity if everyone leaves at once.
Hey, boss, all 50 of us are going to the clinic at 9 a.m.
Exactly. That's the nightmare scenario. If everyone leaves, the factory stops. If everyone stays and gets sick, the factory stops. They are truly between a rock and a hard place.
So how do we solve this? This deep dive isn't just about scaring people, it's about solutions. And our source gives some really specific, almost technical advice.
It does. And there's one technical note in there that I think every single accountant and HR manager needs to hear right now. It's about how you log this time in the payroll system.
Oh, this is the payroll trick. I circled this one too, because you can't just leave it blank, right?
Yeah, never. Ambiguity is your enemy. If a worker goes to get vaccinated, do not just log it as a general absence or a generic permit.
Why not? What's the risk in just calling it leave?
Because if it's vague, it creates a huge vulnerability. The source says you must use the correct label, permiso con goce de sueldo, paid leave under the specific concept of prevención de riesgos, risk prevention.
Risk prevention, that's the magic phrase.
It protects everyone. If it's just logged as an absence, a hostile employer could later claim it was unjustified. And under Article 47 of the LFT, enough of those are grounds for firing someone without severance.
Wow. So a typo in the payroll system could literally cost someone their job weeks down the line.
It absolutely could. By labeling it risk prevention, you're formally acknowledging this was a necessary safety measure. You shield the employee from being fired, and you shield the company from claims that they didn't care about safety.
That's such a crucial detail. Okay, so we fixed the payroll. But what about the operational nightmare of everyone leaving at once? The source suggests an internal protocol.
This is the ultimate solution the analysis proposes. Don't wait for chaos. Create a protocol.
What does that actually look like?
It's simple. It's 3 steps. First, organize shifts. Team A goes Monday morning. Team B goes Monday afternoon. You maintain coverage.
Smart. Control the flow.
Second, documentation. Mandate the official receipt. No receipt, no justification for the paid hours. It keeps everyone honest.
Trust, but verify. Fair enough.
And third, the shield. The source calls this protocol a way to blind or shield the company against inspections.
How does a binder shield you from an inspection?
Imagine the STPS or IMSS walks in for an audit. They want to know why productivity dipped. Instead of scrambling, you just hand them the binder. Here's our protocol. Here are the vaccination receipts. Here's how we actively managed the risk.
You pass the inspection right there.
Exactly. You turn a vulnerability into a strength. The narrative becomes, look how well we managed this crisis. And in the eyes of the law, that diligence is your best defense against those massive fines.
It's proactive versus reactive. It really feels like a maturity test for companies, doesn't it?
It really is. It's a shift from a control mindset to a continuity mindset.
So let's bring this all home. It's 2026. Measles is back. The cases are rising in CDMX.
The risk is real and it's active right now.
The law, while it's a bit tricky and doesn't have a specific vaccine clause, it falls heavily on the side of prevention. If you're an employer, you pretty much have to facilitate this.
You don't really have a choice unless you want to risk bankruptcy or getting shut down. And if you're a worker, you have the right, but you also have the obligation to get that proof.
Right, and the practical tools are there. Label the payroll correctly as risk prevention, stagger the shifts, and document absolutely everything.
Communication and documentation. It sounds boring, but in a crisis like this, it's the difference between a smooth operation and a legal disaster.
It really is. Before we sign off, I want to leave our listener with one last thing to think about. We talked about how blocking vaccination is seen as obstructing a public health program.
Yeah, that phrase really sticks with you.
It does. And it makes me wonder, if an employer's refusal to grant a few hours of leave contributes to a national epidemic spreading, where does the line between corporate policy and public endangerment actually lie?
That's a profound question. Are companies becoming the de facto enforcement arm of public health?
Exactly. Is the workplace becoming the new front line for public health enforcement? It seems like in 2026 the answer might be yes.
And if so, managers need to start thinking less like bosses and more like public safety officers.
A huge shift in mindset. Listeners, stay safe out there. Check your vaccination status, talk to your HR department, and get that paperwork in order.
And wash your hands.
Always. Thanks for diving in with us. We'll get you on the next one.